That's ridiculous.
Good afternoon. I'd like to call to order the Tuesday, October 10th meeting of the Pitt County DSS Board. I'd like to welcome everybody. My name's Jim Cox, and I'm sitting in for Melanie Bryan today. She's not available. I'd like to begin the meeting by observing a moment of silence. Okay, thank you. Thank you. So we go down through the agenda here. First on the agenda today is public comments. We have anybody registered for public comments? No? Okay, so we will move forward.
Mr. Chairman,
Yes.
I move that we accept the agenda as printed.
So do I have a second for that?
Second.
Thank you. So moving right along, we have a second, so approved.
County, the need for some additional staff, resources, and wanted to bring this to you. We are requesting a contract for part-time temporary staff, or at least temporary staff, to help us through. So let me walk you through some of the information. I think you have the slide in front of you, the slideshow, as well as I think you have your packet, a printout of it. As you can see, Pitt County has had a significant increase in the number of children in foster care. This was the 171 is as of September. I believe we've added a few folks since then. In 2013, we were at 108. That does not include the young folks between the ages of 18 and 21 who have been added to our caseload. You can see that between December 31st of 2016 and the end of September, we had a significant jump in the number of children in care. It was all at one time pretty much. And as I noted in some of the data that I have been sending you all along, a lot of these children present very significant problems, mental health problems, behavior problems, and so forth. We're statewide, there has been a 25% increase in the foster care numbers over the last 5 years. Some counties have had even bigger increases, but Pitt is one of those counties. So it's a statewide issue. It is a national issue. Just saw an article that Kansas is seeing 33% increase, and nationally 35 states have seen an increase in the number of children in foster care in the last 5 years. We might wonder what's causing that, and we can guess a lot of things: the drugs, domestic violence, poverty, a lot of the mental health issues of both the parents and the children that aren't being addressed. So those are some of the things that we believe are driving it. Angela's going to cover our foster care costs.
Okay. For our fiscal year 2017-18, I did a total budget for $1.9 million. Our average monthly cost is now up to $205,322 per month, which is up by $40,629, and that is just since July of 2017. Our year-to-date expenditures for room and board only is $615,966. At this point in the fiscal year, we should be at 25% of using this expenditure, and we are at 32%, so we are above. Also, year-to-date expenditures for clothing was $5,800, and this is separate from the $1.9 million, and this is for children that come into care. Depending on the situation that they come into care, they may have to have new clothing, and we may not be able to get the clothing from where they were previously, so we have to buy them all new, or any situation, if they have anything incidentals, that's what this comes out of as well. And we budgeted $25,000 in that particular line.
Right. And, you know, things like school uniforms and things, if they're coming into care, that kind of thing. And kids grow fast, so.
Yeah, they do.
The next slide talks about the children coming into care and the children leaving care. In 2016, we had 63 children to leave custody for a variety of reasons.
Can I ask a question?
Yes, ma'am.
I would like to know, the social services provide the personal care items,
Yes.
and that's in the 58?
That's in the actually included in their board, the room and board payment. It's for all of their necessities.
Okay. Okay. So as you can see by month, we have had, most months have been significant numbers of children coming into care compared to the children leaving care. You can see that a couple of months, I think twice, we've had more children leave care than come into care. And of course, children leave care for a variety of reasons. They're adopted, they go back home, they may move in with a relative, and that relative takes custody. So there are varieties of reasons why children may be leaving care. But you can see at least some months we've had as many as 13 children come into care during that month.
So Janet, question. So a child that's moved into a specialized unit of care, they're still considered being in care?
Right, because they're in our custody.
Gotcha.
So that gives you some sense of kind of what's going on from that standpoint. Other foster care duties that our foster care staff do, in addition to just work with those children that we have in custody. We have the youth in transition from age 18 to 21. That's that new population, and we've got 12 to 15 children in that population on any given day. We monitor children for other states and counties. And last year, I know we had 25 that we needed to do during last year. I'm not sure where we are this year. We also work with relative home studies for other states and counties, and that last year we did 14 of those. We do all of the adoptive home studies for all the children who are the families that are trying to adopt those children. And even if they are currently foster parents, we would need to do an adoptive home study for that family. We do courtesy visits. We license homes for other states. We monitor, obviously, and license our Pitt County foster homes and relicense those when that is up for being done. We locate placements for children, so you can see when we have 13 children coming into care in 1 month, they spend a lot of time trying to find placements for those children because they're the ones responsible for doing that. And then we also have our Links program that works with our children from the age of 13 on up, and we have somewhere around 100 or so children that are in that program at any time. So we do a lot of activities with those children and support those children. So that's what our staff of 18 do, all those activities. The next slide talks about our current staffing. We have 18 social workers, and that includes our new licensing worker. We have 3 supervisors. We have a transportation worker, a data analyst, and a licensed clinical social worker who all work some with the children in foster care, but they also support other folks in the child welfare area. So we have 9 folks who do nothing but work with the children who are in our custody, and the remaining staff work with some of the children in our custody and other duties that we talked about, from trying to find a placement to licensing to whatever. Again, I said we had a 58% increase in children in care since 2013. The staffing that we have added in 2015, we added a transportation aide for child welfare. We did in 2016 the floater position. That was our backfill position that we were using when we had vacancies. That person is now carrying a full caseload. And we have our new licensing worker that we added in this year's budget. And Tasha is sitting in the back. She's just joined us in that role, so she's still getting trained. So those are the new staff that we've hired since this influx starting in 2013. We also have in the last year, about the last 12 months, we've been using 2 of our retirees to help with visitation so that the social workers are not having to spend as much time supervising visitation. Again, ways to juggle and do more with less, but that it's coming back now we're going to have to deal with it. So that's kind of what we've done to try and support the steady increase that we've had in the foster care program. So then when you get to our cost analysis for the social work contract and the actual request, we're asking to use Vanguard Staffing, who does social work and other DSS-related staffing short-term contracts, to provide us with 2 social workers who will be trained. The duration of the contract would be November through April, and then we'd reassess the need at the end of April. We have money both in our temporary contract line item and we have some lapsed salary. And then we would evaluate whether we needed to continue the contract, and we would also be doing this as we looked at our new budget year and whether we needed to go forward. right now, our goal would be to move towards permanence for the children we have in care, and with the number of children we have in care and the size of the caseloads, we pretty much are putting out fires right now. So working on that, we're doing some of that, but not near as much as we need to be doing. So this would allow us to maybe get back in control of the situation that we have right now in foster care. And so then Angela has put together some cost analysis for this.
The anticipated cost for this is going to be $10,880 a month. The rate is $34 per hour that we have to pay to Vanguard. Of course, the social workers don't get that much, but that's their fee. For 6 months, our total contract will be $65,280. And I did the breakdown for 40 hours a week. It would be $5,440 monthly per social worker. Our federal and state reimbursement for this would be $48,960 with a county cost of only $16,320. We have $35,000 that was budgeted for contracted staff that we have not used any of at year to date. And we also have lapse salary. The amount of lapse salary we need for this is $30,280, which we have that as well.
So that's our proposal, and what we would do, certainly questions, comments, based on y'all's input, we would then go to the county manager to see about entering into a contract.
And in terms of your existing staff, how many vacancies are there, well, staff positions, how many vacancies are there right now in the units that are?
In the licensing area and then the foster care unit, I think we've got 2 or 3 right now. Tammy, I've got a list right here.
Is it that?
We have several folks that are coming into it. We've got,
Right.
we've got like the social work position that Tasha just filled. Terry Clark is coming in to be a social worker 3, but will need training. We have Juanita Crandall joining our staff in this particular area, I believe, who is also going to need some training. And so we've got just one left.
Right.
Okay.
One vacancy left.
Once these all come on board. And again, they've got to get trained, some of them.
And how many licensing workers are there?
We have one that is fully devoted to licensing. That's the one that we got this year in the budget. Chandra and Jennifer, I think, do the bulk of the rest of the licensing. So but they also right now are carrying 12 cases apiece. Plus they're helping do placements.
What is the suggested limit number of foster care?
15 children per worker.
And you have 12.
Well, I have 9 that are full-time, nothing but working with the children, and then the remaining 9 do a variety of other things. So in reality, we probably have about 12 FTEs to take care of our 171 plus children and to take care of those 18 to 21-year-olds.
What percentage of these children are placed outside of Pitt County right now?
Good question.
Probably, well, and I don't know if Tammy can answer that question or not. We have a lot of children placed in Pitt County, some in our homes, some in other group types of homes. You know, we've got Easter Seals and all those folks, Methodist Children's. We have a fairly good number, probably about 30 to 40% are placed out of the county, if not more.
Do you have enough children that are placed out of Pitt County, I mean like far away, that would be a position within itself with all the travel, with all that's involved?
Well, what we were focusing on in this year's budget was to try and get as many foster homes licensed in Pitt County to reduce the number of children that we were having to place outside. We probably have several caseloads, if not more, of children that would be placed outside of Pitt County right now. And part of that is because of the therapeutic need. We have children that we try to place wherever we can place. I mean, with the young man that we were working on this past week, we have done applications as far away as Asheville, trying to find a placement for him. Right this minute, he's in Bertie County, but that is a respite placement until we can find a placement for him. And this young man spent, we had to have him in a hotel room one night because we had no place for him. So
Then you had to have someone with him, didn't you?
I had to have two people with him because he's 17 years old, and I would not want one person to have the responsibility.
So the two workers that you are asking for from Vanguard, what do you see them doing in terms of their duties? What would they?
We would ask for them, at this point, we're believing we would ask for them to take some of these cases off of the licensing and those kinds of folks so that they can do what they need to do. We had a MAP class in May, and we have 14 homes from that class we need to license if memory is correct. And we have another MAP class going now, I believe, and Tammy can jump right on in.
Also, we would want them to do some of the home visiting, to make contacts with those children so that we could have our staff here in the office so that they can do the paperwork and all the other things that's required. They will be doing some of the home studies and ICPC requests that we have. And so they'd be doing a variety of things to kind of shift the load so that our full-time staff can do the things they need to.
But right now, the full-time staff are carrying about 22, 23 cases
Right.
apiece if they're full-time foster care.
Exactly.
And then the rest of the folks are doing a combination.
Is there any way you can ease that with the partnership with ECU?
Right now, we have 2 students, MSW students, in the in-home services area. And so we could use them for some things, but at this point, we don't have any in the child placement area. I have spoken with the field placement coordinator, so I will be getting a BSW student in January to place in the foster care area.
Who will be limited in what they can do,
Very
but can
limited
still
in what they
provide
can
some
do.
kinds of activities.
Some relief is what I'm talking
Right.
about, so the
Right.
social worker can be
Right.
doing other more
Right.
private things.
So the workers that you get from Vanguard, when you say they come ready, so they've trained and ready to go.
They are trained, ready to go. They've all worked in a DSS at some point. They've all been through pre-service. So, yeah.
Should be enough.
Probably not, but it's a good start. It will move us very much in a better direction than we are right now. The fact that we've got these folks coming in, once they get trained, that will help us. Because right now, we're having to keep their cases in that mix of cases. So getting all those folks trained and on board, in addition to using the 2 Vanguard, should help us significantly get back on track.
Well, if it's anything like it was, and I think it's worse than the way it was when I was here, there are a lot of liabilities involved in foster care, kids and homes, et cetera. And I, as a board member, would suggest that you request as many as you think it would take to,
Yeah.
because it's
What
huge.
you mean is you
No,
think it would
to
take? I
really-
want to understand that,
Well, as a
because it sounds like to me you're talking money.
No, I wasn't really talking money. I was talking about the necessity of making sure that the liabilities don't make us spend money.
Right. And right now, I would want to start with 2, because I really do think getting all these new folks on board, that's going to help us. When I did the math, it looked like probably 3 is what we kind of needed, but I thought we'd start with 2 and see if that will get us back on track.
Who's doing your MAP training now?
Or
Or how many are doing your MAP training?
Joey, you want to jump
We
in?
have 4.
So 4 rotating, meaning each time you do MAP, say 2 do it, and then, because that's pretty powerful training.
So
Are you anticipating anybody leaving anytime soon? You're not gonna be better off if you get 2. What I'm saying is, at one time, it seemed like everybody was trying to retire, do something, leave.
And family medical leave also concerns me.
Family medical leave has been an issue, although I think right now nobody's on FMLA. The thing that concerns me even more is NC Fast cranks up the end of January if it stays on time for child welfare. And that's gonna put an additional strain on the staff. But if we can get ahead of it, we got to get ahead of it, which is why I wanted, the manager can, if he approves this, can sign this contract without having to take it to the commissioners, which would mean that we could move as of November 1. If I do more than, is it 75 or 70? If it's more than 75,000, he's got to take it to the commissioners, and they won't meet again until November, mid-November. So, you know, let me move. Is my theory, go forward. Let's see
No,
if we
I
can
totally
get
agree with
moving,
that.
and then we evaluate as we go forward. And if it appears that we need to do more, then we will do more.
Okay, one last question. Who's gonna supervise the Vanguard workers?
Be distributed amongst the staff, the
The
current
same
supervisors.
supervisors? Okay.
Right, which means obviously they're overloaded, because they
Obviously.
should have no more than 5
Right.
that they're supervising at
Right.
any point in time. And so those 3 right now are supervising 18.
So Jan, is there any difference of those 171 children in care? You said that 30 or 40% of them are placed out of county.
That's my guess.
So are there any different expectations for your workers of those children placed out of county than those in county?
Not really, not really. And now, we can sometimes get the out-of-county, if it's another agency, maybe if we're in Pasquotank County, we might can get them to make a visit. But generally, we need to do those. It's better for us to do those eyeball kinds of contacts than it is for us to rely on somebody else. Now, I will
Because you're
say,
responsible.
yeah, because we have had to go to South Carolina with kids to go visit them once a month. And then you're also working towards reunification all the time. So again, you've got, or something along those lines, reunification or some type of permanency. So you've got to engage the parents, you've got to do all those things.
So are you seeking a motion on this request?
Yes, I am.
You would have to ask.
Yes, well, I move that we approve the request to enter into a contract with Vanguard for 2 workers.
I second.
Second. All those in favor?
Aye.
Motion approved. Jan, if you just, I mean, I think, you know, as this goes on, I think to keep us updated.
Yes.
In terms of the intervention, how's it going, in terms of the numbers, and if this is enough. But certainly, I think this is important. This is an important issue for us.
Right.
And so,
And it's an important issue for the county, because I know that Mr. Elliott and I have been talking, and he's wondering if I need to do more with the commissioners to apprise them of what is going on. And that probably is true. I
Yes.
probably do need to spend
Yes.
more time on that discussion. So we'll try and schedule some time to do that, but I'll make sure there's either something in the board report or something
Thank
in our discussion each month.
Make it easier if it increases.
okay, we're going to move into item 7 on our agenda here for reports. And it looks like we're going to hear about the SNAP Collaborative. Brian's going to talk with us about that.
Good afternoon.
Good afternoon.
SNAP is the Supplemental Nutrition Assistance Program, or it's also known as Food and Nutrition Services, or food stamps. The SNAP Collaborative was established to look at processes of service delivery and the Food and Nutrition Services Program, with specifically looking at ways to improve issuance of benefits and timeliness of the issuance of benefits. And I would like to introduce Thomas Knight, who's going to give a little more introduction to the SNAP Collaborative. Thomas is our Quality Improvement Section Program Manager, and he's also the team leader for our Pitt County SNAP Collaborative Group.
Good afternoon. I just want to give a brief overview of the SNAP Collaborative. Actually, the SNAP Collaborative began in August of 2016, and the purpose of the SNAP Collaborative is for process improvement based on testing changes using the Plan, Do, Study Act, or we call it the PDSA. We identify, understand, and execute substantial improvements. We do have team members. We have traveling team members, and we also have a home team. I would like to introduce our travel team and our home team. Our travel team sits behind me, Margaretta Howard, Harvey White, Nancy Hero, and myself, Thomas Knight. Also, we have a home team, Brian Averett, Teresa Sampson, Kevin Kreischer, and our director, Miss Jan Elliott. We have 3 different states participating in the SNAP Collaborative. That's North Carolina, New Jersey, and California. From each state, we have 3 counties participating from each state. For North Carolina, we have Davidson, Pitt, and Union. For New Jersey, we have Atlantic, Camden, and Essex. And for California, we have Orange, Riverside, and Sacramento. We've had 2 learning sessions so far. We've had one in San Diego, California, and also one in Princeton, New Jersey, which was, California was in February 2017. Princeton, New Jersey, we just recently got back. That was in September of 2017. We do have one upcoming learning session in either Northern Virginia or Washington, D.C. That's going to be possibly in January 2018. It could be in December, but most likely it'll be in January 2018. And that will be our 3rd and final learning session. And we do have a brief presentation, a storyboard, which a storyboard is basically a story of all the cycles that you have tested in your county. It outlines the PDSAs, which is the Plan, Do, Study Act, and we're going to go into that from here.
Where's our sound?
Is there a sound to that?
Yes, ma'am. Okay, well, Kevin. Could be. Let me go see.
I think you probably want to restart it so that we can get the full essence of it.
I agree.
The suggestion was to click on the little sound button. See if that will work. It worked in New Jersey.
Well, she clicked. Try restarting it.
Okay. Well, we'll just run through this without the sound. It was so lovely with the sound. And Harvey is our IT expert.
Well, he'll get it.
Yes, sir. Thank you, sir. Okay, if it doesn't work, we can do
We
it.
can talk about it.
We can talk about it. That's right. It was just so cool.
Talk about it.
It was so cool. Okay, Thomas or somebody, can y'all stand? If not, I'll do it, but can y'all stand up and talk about it? And we'll need to stop it from a slide to click. No, that's the sound we had before.
Let's see if it cuts off again.
Maybe it won't cut out. A lot of times when you restart things, they
That's the
tend
secret.
to.
That's the secret. The reboot.
Anyway, this was the presentation they did in New Jersey about what we've been doing here in Pitt County.
Oh, no.
There it goes again.
Yeah.
Okay. So we talk.
Talk us through it. Y'all can talk us through it.
Is it set up so that we can click each
Each
slide?
slide, yeah.
And then
Yeah.
I'll do that while you talk about it if you want to. So we can
Anyway,
stop
the
the
business,
There you go.
Probably you're gonna have to have somebody stand here and pause
best
it,
laid plans.
Hit the high points.
All right.
and then click to the next one.
Okay.
Okay,
All right.
get to the microphone.
All right. First of all, we got our interlocking project aims. Number one was the timeliness of FNS processing will be approved, especially for recertification and expedited intakes. Number two was communication with clients would be made clearer, faster, and client friendly, and more supportive of the goal of eventual independence. And last, it was case documentation would be made more consistent, thorough. All right, now be 100% for FNS processing.
A little bit right there.
Get it?
The speaker there.
The timeliness of expedited intakes has gradually increased since mid-2015. As you can see on the graph, we've been going up since January of 2015.
And our goal each month would be to be at 100% timely.
100% for
Expedites.
expedited, and really want 100% for everything, regular and expedited. And here are some ways what we're doing to maintain our momentum and to place greater emphasis on the recertification process. Clients are often not aware of the need to recertify their benefits every 6 months. This leads to untimely, late, or churn application, as well as frustration among both clients and caseworkers. The problem is substantiated by caseworker observation and also by analysis of 91 incoming calls by the Human Services Call Center on 7/21. We ran a test.
And 91 people were complaining on that day
On that
about their
particular.
benefits.
And here's the graph of the explanation of the majority of calls that we got directly due to communication problems. 7% said that they needed an explanation for decreased benefits. So their benefits went down, they needed an explanation why their benefits went down. We had 2% that needed replacement EBT cards. 16% did not receive their expected benefits on time or didn't receive them at all. 7% did not receive a mail notice, so they were not notified by mail what was going on with their case. 43% had a desire to speak with a supervisor, and 25% had difficulty contacting their caseworker.
Which probably led to the desire to speak to the supervisor, right?
Exactly.
Yeah, it'd be interesting that 43% define the cause of that. Why did people want to speak to the supervisor?
Yes. We've listed here the recertification communication process, which consists of 13 steps, including at least 7 potential problems. We have attempts to contact the client. That's a total of 32,000. Clients provide information to DSS. Clients takes no action. Address is incorrect. The notice is forwarded to DSS after about 2 weeks. Information is sufficient. Recertification completed. Information is insufficient. DSS attempts to contact the client. DSS makes the contact. DSS does not make contact. Client provides information to DSS. Clients does not provide information to DSS. Recertification fails. information is sufficient, recertification completed, and information is insufficient, recertification fails.
And some of the reasons that the client and the worker don't connect could be phone number's not correct, they don't have a voicemail, a variety of reasons as to why the worker and the client can't connect.
That's correct.
Is it possible to ask a question right here?
Yes, ma'am.
My experience with this, with the younger crowd, they tend to not answer the phone anyway. They texting.
We
And-
have a plan. We have a plan for that.
You got okay.
And that will be coming later.
Because it makes me angry when my children don't answer the phone. They say, "I text me, mama."
Okay, on the next slide. Problem one, client takes no action in response to a 4-page form from the state DSS, which is sent near the end of the benefit period, and that's the recertification form. This appears to be connected, at least in part, to the fact that the state form may be intimidating or difficult for some clients. And here's a sample of the form. That's our recertification form.
And his writing is usually small.
Yes, ma'am. The county will soon begin to supplement the state letter with a sample wallet-size reminder card, which will be given to clients at each recertification interview. And here's a sample of the card. It has the time frame that they should contact their caseworker regarding their recertification. We will fill in the blanks with them while they're in the office during their interview. The reverse side of the card contains information about the county's job training and placement program for FNS clients. And this is related to our employment and training program.
So did you come up with the card? Was that your group's idea?
The group came up with the card, and Kevin Crusher, he designed a lot of
That's a
the
good
stuff
idea.
on the card.
And it works.
Great.
Well, we'll know soon.
When provided to clients by mail, the reminder card will be accompanied by a simple letter that reiterates the message. And here's a sample of that. The card and letter also addresses the problems of obtaining the correct addresses, phone numbers, household changes, and other information. And there's a sample of the card up top. Okay. The card and letter also addresses the problems of obtaining correct addresses, phone numbers, household changes, and other information. And this is the workflow chart that we went over just a few minutes ago. Another PDS that we have is placing a reminder message on the large video monitors in the client waiting areas or in our lobby. And they will be notified of this.
They should see that.
It should.
And this is just a illustration of what happens if you go to the grocery store and you've not checked your card. You can possibly get to the register and you won't have any benefits on your card. And the thought behind these pictures is to say that our reminder cards would remind them of their recertification, so this won't happen.
That's a good idea.
And here's what often happens. Most food stamps or food and nutrition services or FNS clients are approved for 6 months of benefits at a time. They have a 6-month certification period. Okay, next slide. During the first half of the 6-month State regulations require food stamp clients to update their information with DSS, and that's through recertification. Clients receive a reminder letter from Raleigh during the 5th month, and it's always around the 10th of the month, and that is your food stamps recertification form when it is mailed out from the state. If someone does not receive the letter or loses it or ignores it, the food stamp benefits will stop. That's if they fail to recertify. So the question is, so how can we keep your benefits from being interrupted? Let DSS know if you change your address so you will be sure to receive your reminder letter. Let DSS know if you change your phone number so DSS can more easily contact you. Make sure your phone is set up to receive voice messages. And watch for the letter from Raleigh during the 5th month. It's always, like I said, always around the 10th of the month that letter is sent out. And here's another sample of the recertification. To encourage greater independence, messages about DSS services are
Interspersed, yeah, with the,
with
Can't
lumber
read it.
presentations about how to find and get good jobs. Even when information is received from clients in a timely manner, it is often not easily communicated amongst caseworkers because of inconsistent approaches to case notes. This reduces caseworker cooperation and efficiency by forcing workers to hunt for information in case records, sometimes only to find that the information is incomplete or difficult to understand. The problem was addressed by giving workers a simple template describing a standardized way of documenting their case. And we came up with a case note template so all of the workers will have a guide to do the case notes for FNS.
Northwood doesn't do any of this.
we don't do any of that for economic services.
Caseworker report that the template has been helpful in fostering better coordination. A second version of the template is currently in development, and other approaches are being evaluated that may possibly improve coordination even more. And we actually have finished the second version, and we are using it. For example, the pool method of case banking was tested twice. Many clients reported that they did not receive their mail from DSS in a timely manner. For example, they reported receiving notices of interviews only 1 or 2 days before the interview date. Using staff addresses, it was found that the typical mail required 5 to 6 days to get from DSS offices to homes.
If it works.
And here's a little
'Cause if
breakdown
you're in
of
a
where it
rural
goes.
area, you don't know where your mail is going.
In cooperation with management information services, DSS worked out a more streamlined system that now consistently allows clients to receive their mail within 2 to 3 days.
Process improvement.
Clients often appear to experience confusion in navigating DSS Human Services Center. For example, they would overlook or misunderstand signage, line up at the incorrect service window, or become frustrated by waiting times. In cooperation with the Senior Community Service program, DSS is arranging for greeters to be placed in the Human Services Center waiting area, transitioning from a DMV services model to a Walmart model. And what that is, we're trying to get some greeters to help us in the lobby to move traffic in the lobby to make it smoother for the clients. The greeters would also help clients to find other resources for employment, healthcare, mental health, and emergency food. And here's a list of our food pantries in Pitt County. Thank you.
Thank you.
And to Ms. Perkins Williams' question, we are in the process of testing a texting way of contacting all clients who give us permission to send them reminders around food stamps. So that is just getting underway now.
Thank you.
Are the greeters volunteers or paid?
It is a program, it's a training and employment program for seniors. So they're not paid by DSS, they're paid through this program that's through the state.
Okay.
It's Title V.
It's Title V.
Okay.
Right.
So Brian, the New Jersey connection, so you did this presentation in New Jersey?
It was done in New Jersey. The traveling team went to New Jersey, and this presentation was given there. Each of the 9 counties gave a presentation as to what had been identified and the progress made and what had been implemented. And
Congratulations.
thank you.
Okay, next under reports, we have holiday cheer. Not sure what that is.
Well, you'll know shortly. Several of them already do.
Money.
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 Okay.
Good afternoon.
Good afternoon.
I'm here to talk to you about our foster care special needs and holiday fund. It has been a long-standing program here with Pitt County DSS, and if I'm not mistaken, it was started back when Becky Starkey was working here, and I believe also, I understand that your mother who's passed away, she also was instrumental in getting this started here at Pitt County DSS.
You want to kill me now or later?
But no.
Christmas
much later,
Eve,
but
she might be close to. Yeah.
But it's hard to believe in this warm weather outside that we're talking about holiday cheer, but 2.5 months from now will be Christmas time. The Pitt County Department of Social Services is starting to make Christmas plans for the foster children from whom we have legal custody, and we do rely on donations from generous citizens in the community like you to be sure that each of our children will receive a visit from Santa and have a happy holiday. Currently we have approximately 183 youth. That's including some of our older VPA that do not have a family, and that we would like to be able to help them at Christmas time, also provide them with something. And so we do ask the community to help in different ways. There are 3 different ways that we ask the community to help provide Christmas items for our foster children. You can sponsor a child by providing items from their wish list. You also can provide new unwrapped toys or clothing items that donate to the agency, or you can provide a financial donation for the purchase of items or gift cards for our older youth. We sort of know that our older youth like to do some shopping on their own. They're more particular about, I can't pick out clothes for my teenagers. She wants to pick them out. And so the social worker will often accompany the child or the foster parent and take them shopping with that gift card to pick out their Christmas items. So please send all donations and contributions to Pitt County DSS at 1717 West 5th Street. And if you can earmark your donation for foster care special needs and holiday fund. And if you need more information, please feel free to contact me with the number provided or the email address provided. And we do thank the community for their long-standing support of this program and for sharing the true meaning of giving with our children. And we wish you all a Merry Christmas.
I have, sometimes people I have had one question that says, what's the difference between this and Toys for Tots?
Well, this is an in-house program that we started years ago that we've got, in fact, I'm already getting emails from contributors, and so we ask them, we have in the past provided through donations from just private contributors to provide the Christmas items for the children. We've not, connected with the Toys for Tots.
Because I know there's two communities north of the river that wanted to help children like that, and they have a big toy drive. I have to take something, but they are one thinking, that this is where it's going. But
Ours is just for the foster children. Toys for Tots would be for any child in
Any
the
needy
community who has a need based on family income.
Okay. This is just for our children in our legal custody. And so we do, we have a system where we do have the social workers, work with the foster parent and the children about a wish list. And we say, look at the variety of items. And then we have sponsors who say, we would like to sponsor 3 or 4 children. We have groups from ECU, different departments. We have different departments over at Vidant Medical that every year contact me and want to support and sponsor specific children. And then we have some churches who just want to provide financial donations to help for the older youth, and to also, some just want to do like a toy drive. Because if the kid's not sponsored, we use those toys, those new toys that are new clothing items that are donated, to make a Santa bag for those children who have not been specifically sponsored, so they'll have their Christmas.
I just thought it would be good for the public to know that, because that question has come before me.
Okay.
Joy, is it still kind of understood that it's new toys that we want rather than used toys?
That is correct. We do put that in our letter, and we're getting ready to, or I'm getting ready to work on getting the letters. My unit is out to the contributors, but we do, put that in there.
If someone wants to sponsor or take on one child, do they just contact you, or?
They can contact me, and with the help of the other 2 supervisors in child placement, we gather this information about the children, and we have found over the years it's easier to have one person sort of divvy everything out, and then we ask them all to help with when they deliver toys, or into getting the toys to the children at closer to Christmas time. So it's a joint with people in child placement.
And if there are any funds left over and we need monies for a child for band or for camp or something, then sometimes we might tap into this.
Okay.
Thanks for doing that.
All right, thank you.
You have a question?
Yes, Scott?
Yes, I had a suggestion. I know the Toys for Tots, and I think the University City Kiwanis Club with their Santa project, I believe they've been coordinating to check names to see if kids' names aren't being put in multiple efforts. So DSS may want to try to coordinate with them to see if they could check the names against names going into those efforts, so that somebody's not participating in multiple times in multiple projects.
Right, and we are also a group that works with Toys for Tots as far as giving them names and things, so we do
You're in that
coordinate.
Good, thank you.
I'm here, I'm the program manager with Adult Services. However, the actual individuals who are responsible for this program, the social work supervisor, Sharon Alexander, and we have 2 adult home specialists, Jennifer Stroud and Tammy Corbett. So this is their presentation. I will try and do it justice for them. We have a very similar program that was created many years ago. I've been here for 25 years, and it was in place before my time when I came. Back then, we had much less facilities here in Pitt County, and much less individuals in those facilities. Primarily what we do is we look at the adults that are in facilities that we are guardian of, as well as the adults in Pitt County in facilities that don't have family or anybody. So we try and do things here because we are responsible for the assisted livings and regulating assisted livings and family care homes. We try and make sure that the individuals in those homes that have nobody, that somebody is out there looking for them, since we are a regulatory responsibility. So we do 2 different kind of populations among our adult care homes with our funds. So in adult care homes, for those of you who don't understand how they're funded with public assistance, the individuals who are receiving assistance in them, all of their income plus the assistance they get from Medicaid is what covers their cost of care at the facility. Any co-pays that they have, any over-the-counter medications, they're taken out of the residents' funds. Each resident that is receiving assistance in a facility gets $66. That's all they get. That's their socks that get thrown in the dryer and don't come back. And in an institution machine, they eat more of them than we do at home. So if they got stuff at Christmas time or they came in with stuff, often the residents that we bring in, that we do placements, they come in with just a small amount of clothing and it doesn't take long and they disappear. So their $66 has to go for their co-pays. We have individuals who are on lots of medications, so they might only be getting $5 or $6 out of their $66, depending on the medication load that they're on. So that extra money is where they have to buy all of their personal care needs, all of their clothing. If they get a haircut at the beauty shop in the facility or anything, that's all their personal funds. So if you want a nurse's aide cutting your hair, they can help. The facility helps with that. But if you want it to be done by somebody who's trained to do it, you have to pay for that. So their own personal funds are very limited. So what we try and do is provide assistance to them. We have adults that are range from 18 to 95, I think is the oldest one that they've had in past recent years. So we rely heavily on community support. What we do is we take the funds, very similar to children's program. We have individuals that sponsor. They call and say, hey, we'd like to sponsor an adult. I had somebody come and talk with me about a month ago, and they said, you know, I'm really concerned about somebody. I'm not really family. I came to know them because I sponsored them, and it was 8 years ago. And they've developed a relationship. And that person is a part of their family, has been to their home on holidays and things like that. So some of the connections that are made this way, individuals continue to maintain because these individuals have nobody. So sometimes we have organizations. We have Girl Scout troops. We have physicians' offices. We just have different people who think of this population and would like to sponsor. Sometimes it's a one-time opportunity where they go, and then sometimes it develops into much more things throughout the year. We have people who would like to sponsor somebody, and they'd like to take the gifts and actually go meet the person and deliver the gifts. So somebody who sponsors, if they have a unique need, if they have an organization that wants to sponsor and come, sometimes they want to come and sing Christmas carols. So any type of unique opportunity, if you have a civic organization, your family, we have families who say, you know, hey, we want to sponsor somebody. And we pair them with an adult who would like that opportunity to have somebody visit with them. Among our ward population, I can tell you I have wards that we have that want video games. We have ones that I can think of that would want a baby doll. And we have ones that want a case of sodas. Like they never have money, things that we take for granted that we get to use. They would really like that would be a present to them, to have some personal snack foods in their room. So there's lots of variety of needs. We have one individual who we're guardian of who likes to draw, and her art supplies get used up through the year. So there's lots of unique needs, interesting people that have needs at Christmas, and so we try and pair them with people. So again, I've kind of gone over some of the different ways. We have wish lists that you can fill a wish list. We have some civic organizations that go and visit. And we have some people who just do a sock drive, personal care drive. We had a student at Conley a couple years ago who actually put together and collected tons of personal care items. And that was extremely helpful to have those on board. When we get new placements and somebody that gets placed, it was incredibly helpful to have what was left over just on board when somebody was placed. And we have some people who choose to just make a monetary contribution. Say, hey, I can't do a whole lot, but here is a donation, and then you all use the funds where you see fit. anything that is left over after the holiday season, when everybody's been sponsored and taken care of, that sits in our fund. And as we have new placements during the year or just an unexpected need that would fall in the same line, we try and use those funds to take care of what that need is. You can send monetary donations in, and then the phone numbers are listed also for the first two are the adult home specialist social workers, and the last one is the supervisor. So, any questions?
Questions? Thank you. So now I understand about holiday cheer.
That's right.
Okay. Okay, next on the agenda, we're going to move into Jan's report, the director's report.
Okay, I'll try and move fairly quickly, because we've had a lot today. First thing, of course, is our agency personnel report. We've sort of covered that a little bit already when we were talking about foster care. And you can see that our numbers have gone down significantly in that area. We are placing, we're hiring, we're getting things done from that standpoint, so we're moving right along there. Unless somebody's got questions, I really won't spend any time on that. The Medicaid application processing report, you should have that in your packet. We mailed you one or emailed you one, but the new one we placed at your desk. The state has said that since the Medicaid report was not accurate for the first 6 months, that they're going to go, and we're not going to have to worry about that report anymore. It is gone. So they're going to start measuring us from July 1 forward to determine if we meet we fail 3 months consecutively or 5 months out of 12. So we are now starting brand new, and we're showing you beginning July 1 where we stand. And so if you look at the Medicaid MAD percentage process timely, we're running 94%, 91%. Other Medicaid, 91%, 93%, and the standard is 90%, so we're above standard. If you look at the process and time, remember we have to hit all 4 of these areas. If you look at the process and time by month, again, we've got the standards for you here. For MAD, we were at 54 days and now 48 days, and for other Medicaid, we were at 26 days and now 25 days. So the standard, again, is 45 and 90. So staff are doing a fantastic job, and we're going to be perfect, right? Teresa's out there shaking her head. So anybody got any questions?
Goal.
It's a good goal. That's right. You shoot for it. Thought I would bring you up to date a little bit on what's going on with the House Bill 630, which has been all over the countryside with different names. You have the timeline in your package that was sent to you by when we sent out the regular package. You also, I placed at your spot some slides that were done at the Institute of Government, School of Government, when they were working with the group. And I'm going to run through just a couple of these, but I'm not going to spend the whole time on it. We could spend hours. If you look at the timeline, what I will say is that there are 2 pieces that are already in effect right this minute, which is the licensing within 90 days of application and having to have a certain amount of visitation in person. Those are already going on. On September 30, they were required to release the RFP for the proposal to do the study from the outside contractor. That RFP was actually issued September the 29th, and it will probably be opened around November 16th. That's when it's due to be back to the state for opening. And so you can see what their requirements are. They're supposed to be reviewing social services in North Carolina and making recommendations about where we can improve and looking at child welfare as well as social services as a whole. The other thing, your appointments to your committees, who is doing the study, it's called the working group, that is in your packet also, and you have a list of those folks. The members, the chairs, Senator Tamara Barringer, Kathy Harrington, and Senator Joyce Kerouac, I'm not real sure how to pronounce her name. They're the three members from the Senate, and the co-chair, as you see, is Senator Barringer. Representative Stevens is the co-chair from the House, and then we have Jonathan Jordan and David Lewis. DHHS has their representatives. You can see the whole list. What I will say to you for county commissioners is Kevin Austin of Yadkin County, Brenda Howerton of Durham County, Paige Limmel of Transylvania County, and Bob Woodard of Dare County were appointed, and many of those folks have been or are currently social services board members also, as well as county commissioners. So even though social services board members didn't get a specific representative as such, they are being represented by these commissioners. DSS directors have 3 representatives, 2 appointed by the House and Senate speakers, and 1 appointed by the Departments of Social Services. And you see those are Chris Dobbins, Gaston County, and that is a consolidated county. Glenn Osborne from Wilson and Susan Osborne from Alamance. And then the Association of Social Services Attorneys, Angie Stevenson, has been appointed to represent. So that's the members of the working group who are trying to put all this together, and will have a report done to the legislature. Their first meeting was October the 3rd. They're on a real aggressive timeline. I did listen to the meeting some over, because you can hear it over the internet. And a couple times the committee was trying to slow things down, and Senator Barringer said, you know, in this legislation it says if you aren't moving, I can move for you. So she was very clear that they would move forward with or without the committee. She also indicated that I can tell you that the driver's license pilot project's also underway. They're working on, there's a work group on that. We have a representative on that work group. So let's see. The Child Wellbeing Transformation Council has not been appointed yet, but the senator did indicate that they were beginning to develop some names for that, and there will be at least 1 DSS director on that. Written agreements with DHHS, those begin July 1 of 2018, and there is a work group pulling this together. The department has some stuff that they're doing. The association is trying to put together the wants that we believe we need from the department to be successful, because an agreement is a two-way process. And we will be monitored based on that. So anyway, you do have the timeline. Several of these things are in process right now. 2020 will be here before I know it.
Yeah.
Right. So the handout, the slides that I gave you were some of the slides that they used at the work group. And so the School of Government said that this is kind of like a puzzle, trying to put all these pieces together. And so they've got all the different parts listed here. They have the social services, the work group. They have the contracts piece. They have the reform plan, the regional departments that are being developed, and the Child Wellbeing Council. And the regional departments that are being developed, that would be regional departments of social services, because that is not off the table. That is part of the study. So that would be part of the puzzle that needs to be dealt with.
It's not gonna go away either.
No, it's not going away. So the puzzle pieces for the work group are that once reform's underway at the state level, how should a new and improved state system use regional offices, because they're going to put state regional offices out there. And that's one of the pieces that's really great and that we're excited about. And they're going to help provide oversight and support for the county departments. And so that's something that this work group's supposed to be working on. When they get to the second phase of the work group, they're also going to be talking about, in the county administered system, what changes are needed to improve coordination and collaboration at the county level, and what would a regionally administered county system look like? So that's still part of the discussion. So the work group is also supposed to be looking at, again, the state regional office structure, size, number, location, what kinds of responsibilities for supervision and administration, what's going to be the accountability of those regional offices. And then in the second phase of this, they're going to be talking about the role of county commissioners, how they're going to have information sharing between the regional offices and the county commissioners regarding a department's performance, and then the options about how the county commissioners might intervene prior to a state assuming direct control. So all that is part of that discussion that is ongoing, because by 2020, if the contracts that are signed, if we're not doing what we say we're going to do, there is the provision for takeover by the state. So that's kind of what they're working on. You've got your timeline here. The blue timeline is stage 1, so the committee has to have their report to the department by April of 2018. DHHS has to have their plan to the General Assembly by November of 2018, and then regional supervision is supposed to be in place by March of 2020. And so then you've got what they're calling stage 2. That is a report that's to be done to the Joint Legislative Oversight Committee, and then how does the General Assembly and DHHS, what kinds of actions need to take place. And that study that's being done is going to have a whole lot of input into how all that plays. The reform plan that they're developing, which is part of that study, they're contracting with that outside organization. They're going to evaluate the role of the state, the direction for social services systems, child welfare reform. They're going to put together a dashboard or report card for counties. That's going to be all part of this process, using NC Fast as a vehicle. And so we'll see where that goes. The contracts piece, as I said, that's already being worked on, and it talks here in the slides about what that contract might address, those contracts, and that what happens after federal fiscal year, after the fiscal year of 2020, 2021, and the corrective action process. And you see that if you fail to complete the plan, the corrective action plan, the regional office must temporarily assume all or part of the administration of the county department. Then the Child Welfare Transformation Council's talked about here. That's another piece of the puzzle. They are working on the initial appointments now for that group, but they have not fully decided who all or made those appointments yet. You have some understanding of what they're going to be doing. And then after March of 2019, multi-county social services agencies will be allowed to combine and maybe forced may not be the right word, but encouraged maybe is the right word. And it talks here about what that might look like, that the county still have to contribute, you'd be a public authority, all that kind of thing. So that's it was going to be longer, but that's my quick overview of what's transpiring as it relates to the reform bill that all of us have been very interested in.
It's amazing how they easily come from the state that says counties will have to contribute financially to the district. When they send laws down, they don't contribute to it their share when they make those laws to do that. I tell every one of them I know.
I do have a question. What are the perceived advantages of this reform?
What was said, right, it's broken. What was said when it was proposed in the legislature was that we are not doing well as a state, and that part of the problem might be that the state has too many offices to supervise. So if we could reduce the number of offices, we could enhance the oversight, because trying to deal with 100 counties as opposed to 30 regions, that was one of the statements that was made. But the biggest issue is that the system is not functioning well from the perspective of many people in child welfare.
Mm-hmm. Is there a prototype or a state that they're using for best practices with this?
I think that's part of what that contract is going to go out and look at. To our knowledge, some of the research that's been done by our association is that there are a couple of states that have tried this, but it hasn't going very well,
thought
or
it
it,
worked
it,
out.
it was, or it's still too early to assess. And remember, in all but about 10 states, the state is the operating agency. North Carolina and about 9 other states, we are county administered, not state administered. So there's not a whole lot of people to compare with. Other questions?
So are there, at our meeting next week, are there any informational sessions about what's happening with this?
I'm pretty sure there will be some discussion about this, yes. Yes. So that's my quick update. I didn't know if anybody had any questions about what I sent out as far as my report for the month. I will indicate a couple of things that are going on. We have, that's not on your list here, we have trash pickup on Old River Road on October the 14th, which is this coming Saturday. All the DSS staff, or some of them, will be out there picking up trash. Anybody wants to come join us, we can certainly use you. We're meeting at 8:45 at the food line out there near Old River Road, and we start at 9 o'clock, and we're doing 2 miles. And we do this once a quarter, and I pointed Ms. Perkins Williams because she's kind of out that way, and has indicated it's been helpful.
Been helpful, but it's a lot of trash out now.
Yeah. So
People are afraid of snakes.
well, true. I am too. And then again, I mentioned to several of you, Domtar has made a donation for new mothers that we will be recipient of some of what they're donating. It is some diapers, newborn diapers, and some books for children to be given out to families. So we'll have a small number of those. I think they're doing something like 1,500 countywide, so, but we'll have a small number. So we're excited about having those resources. But anything else anybody's got?
Any questions for Dan? No. Okay. If not, let's move into board member comments. Anybody have anything they'd like to announce or share? Okay.
Did you have something you wanted to ask?
I look towards you, Mary.
I'm gonna delay my
Okay.
asking.
Okay, if there's no board comments, I will ask for a motion to adjourn.
Please adjourn.
In a second?
Second.
So moved. Meeting adjourned.